Dr. Rosof, on the monitors in this room, there are slides from 5 presentations from different speakers who appeared before your committee on February 29th of last year. As you can see, these speakers appear to be giving the committee the message that this illness is psychiatric, stress, PTSD, and so forth. Who selected these speakers to present to the committee?
Let me correct some of the statements that were made initially. The selection of the speakers to the committee was done by our committee. It was not done, as indicated previously, by Dr. Peterson or any other individual. It was selected by our committee. The committee wanted to better understand the treatment modalities that would affect positively the veterans and their health. We reviewed, identified...
Excuse me one thing. Did VA or DOD have any input into the choice of these speakers?
The committee made the decision on what speakers to choose. Clear understanding on the part of the committee. We reviewed, in addition, 6,541 unique references in enabling us to make some decisions about the treatment of veterans. So our conclusions were not based solely on the people who you saw. In addition, there were others. And if you read if our report is read clearly, you can see our conclusions were not that this was a psychological or psychosomatic disorder. We clearly make the statement, we do not know the etiology. No one treatment will be able to affect positively the treatment for patients with CMI, chronic multi-symptom illness. It requires a group of physicians, a team-based approach who understand the patient, who enable the patient to have a decision in the care he or she receives, and at the same time better understand the satisfaction of the veterans in their care. We strongly believe that this is an illness that has and requires a multimodal therapeutic intervention.
Dr. Coughlin, on October 23rd, this subcommittee asked VA how many veterans have self-identified as suicide and later committed suicide in the follow-up study of a national cohort of Gulf War and Gulf era veterans. On February 19th, VA responded stating, quote, VA has no evidence to date that any veteran in the study has committed suicide, unquote. Are these the same results you saw in your study?
Yes, fortunately, we did not lose any of the research participants. As I mentioned in my testimony, my efforts to identify mental health professionals, get involved with the study as co-investigators to place these callbacks to vulnerable research participants were initially blocked by my supervisors, and that's why I contacted the IRB chair in writing and also the VA Office of Inspector General. After a delay of 2 or 3 months, we were able to start the callback process, and a team of mental health professionals at the Washington, D.C. VA Medical Center did a fantastic job of reaching out to the veteran. We had vets who had been told by their local VA clinic or hospital that they were not eligible for free health care. But when they called the toll-free number and reached somebody in VBA in the VA central office, they were told the opposite. So the social workers were able to sort this out and get them into health care. These were vulnerable veterans, men and women, who had major depression or other medical and psychiatric conditions, and they needed assistance to get into health care to save their lives.